Good morning, my 7th grade class, possibly my 8th grade class. It is March the 8th. I'm really sorry. I didn't realize I had a doctor's appointment this morning. But anyway, I'm putting together your lesson for today. At this point, just as a review, you should have already done the word root quiz, prefix quiz, suffix quiz, and you should have finished medical terminology identification. You should have also finished matching health careers. And then if you haven't finished this today, we are going to talk about it today. So we're going to start off with going over these. I'm not going to type up what they mean. You should have been able to find them. There's a handful, but there's a couple of videos that you could watch on the day of instruction to kind of tell you what those mean. Like I think Opher isn't there and pharynx isn't there. Trachea should be. But Opher means ovaries and pharynx means pharynx. So if we're going to go over this real quick. Peri means around, cardi means heart, itis means inflammation of. So if you're wondering, what does that mean? Let me go ahead and, I don't know if I can pull up another screen while I'm screen recording. There it is. All right, pericarditis. There is a sac that your heart lives in, and it kind of surrounds and protects the heart. It's called the pericardium. Okay, so this is what a normal pericardium looks like, and this is what pericarditis looks like. I believe I covered this with all of my classes. Typically with inflammation, you're going to see swelling, you're going to see increased redness, increased heat, increased pain with those items. So that would be pericarditis. Alrighty, let's go back to the worksheet. Cyanosis. Cyan means blue, osis means condition of. And if we were to find a picture of that, pretty much it's when the tips of your fingers, toes, and then lips turn blue due to lack of oxygen. Okay, so you can kind of see they're not like truly blue like the tile behind it, but you can see that the color differential from this normal color is a bluish shade. All right, so back to the worksheet. Dysuria. Dys meaning difficult or painful, and ura meaning urination. Hydrocephalic. Hydro meaning water, cephalic, well, it's really cephal meaning head. Okay, so in order to explain this, I do have a diagram for you because it just makes more sense to see it. It's when somebody has an increased amount of cerebral spinal fluid in the ventricles of the brain. So you can see this person has no hydrocephalus, this person does. So you can see the increased pressure on the brain. So you can see the difference between the two. And obviously it's not water in the head, it's cerebral spinal fluid. I didn't name it, it just is what it is. Hepato meaning liver, megaly meaning enlargement. Hyperemesis. Let me see if I actually have a picture of your liver is actually very, very large. I do. So here it is. Yeah. So here you can see this is a normal sized liver. This is what you would see if it was enlarged. And I know you probably are comparing it side to side and you're like, oh, it's not that much bigger. Internally it is. It puts a lot of pressure on your other stuff. So anyway, that is when you have an enlarged liver. If you're a big pictures person, I'm sure this helps to see. Alrighty. This is excessive vomiting. I told you guys before, this typically happens with pregnant women. And it's just nonstop vomiting for them. It is not fun. It is a medical condition. It is beyond just your normal morning sickness, which don't let anybody confuse you or fool you. Morning sickness can happen literally any time of day. So that is very misleading. Lipoma, Lyphoma. If you watch Dr. Pimple Popper, she deals with these a lot. Lipo meaning fat, oma meaning tumor. It's an overgrowth of fat cells that create a tumor inside of your body. Tracheostomy. Trache meaning trachea, ostomy meaning surgical opening. This is typically done if we can't get an airway open through like intubation because there's something blocking the airway, and so we have to make a small surgical opening in the trachea, and then we would put in a tube to allow that person to breathe. Erythrocytopenia. You probably found erythro, you did not find cyto, but you found cyte. That's perfectly fine. But that is red cell deficiency, meaning that they have a low amount of those. Otosclerosis. Oto meaning ear, sclerosis meaning hardening of. And if you're wondering what this is, It is the most common form of why people have hearing loss. You have these 3 teeny tiny bones that live inside of your ear. Okay. The way that it works is you have sound that travels through the ear canal and then it rings on this eardrum. That vibration travels through these 3 teeny tiny bones, boom, 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 and then it rings into the cochlea, and then that is how we can kind of interpret sound. Well, over time, these bones will harden and fuse together, so the vibrations are not as distinct when they hit these 3 bones, so it causes hearing loss. So that is otosclerosis. Intercostal. We typically use this to talk about between the ribs. So like I had a shirt that said the best way to a woman's heart is between, I think it was the fifth and sixth rib. So you'd be going through that intercostal space, so between the rib. Opherectomy. Opher means ovaries, ectomy means surgical removal of. Hysterectomy. Hyster means uterus, ectomy means surgical removal of. Nephrologist. Nephro meaning kidney, ologist meaning one who studies or one who specializes in. Hypodermic means below skin. So there's something called a hypodermic needle. You'd put that below the skin. Rhinorrhea. This is what we would call in the medical term a runny nose. So that is a nose for rhino, and then urea meaning flow or discharge. Mammoplasty. Mammo meaning breast. Plasty means surgical repair. Pharynge meaning pharynx. Gitis meaning inflammation of. So this is inflammation of the pharynx. Osteomalacia. Osteo meaning bone, malacia meaning softening. Okay, osteomalacia. So you should have those answers for your medical terminology. I would suggest you go through them. You may need to go back and re-watch this part to double check because I did go by that very quickly. But I told y'all I want you to try to work on this on your own. I don't want to just give you the answers. So the matching medical careers, you were trying to find who you would go to for each of these diseases. So for an eye infection, would I need to go to a kidney specialist, skin specialist, stomach specialist, heart specialist, vein specialist, someone who specializes in the eye, someone who specializes in the brain or nerves, a surgeon, a doctor who cures cancer, a thoracic surgeon, a psychiatrist, which is a specialist of someone who specializes in the mind, or somebody who specializes in the teeth. It makes the most sense that I would go to an ophthalmologist. All right, craniotomy, that is a surgical removal of the skull. There's 2 you could pick. They can both do it, but I'm going to pick the person who would probably do this the best. That'd be a neurologist. So I'm going to put G, and excuse me, because this isn't going to look good. Blood drawn, you're going to go to the vein specialist, a phlebotomist. Hematura, you have blood in your urine. Sounds like a rough day for you. You would need to go see a kidney specialist. Stomach problems would be a gastrologist. Carcinoma, you'd go to a doctor that cures cancer. Multiple personality disorder, that would be a psychiatrist. Skin rash would be a dermatologist. Pericarditis would be a cardiologist. Hepectomy, which is a liver removal. You better go see a surgeon for that. Okay, if you want someone to cut you open, you want somebody who's been doing it for a while. Arterial sclerosis, that's going to be hardening of the arteries, so you need to go to a cardiologist for that. Chronic cephalgia, we know that cephal means head, so I'm going to go ahead and say a neurologist again. Gingivitis, inflammation of the gums. Dentist, schizophrenia, that'd be a psychiatrist. And then a pneumoectomy, that is going to be a thoracic surgeon, because if you're going to have a lung removed, that's who you're going to want to see. Alrighty, so we reviewed that page. Sorry, y'all. Last page here. We had the medical terminology challenge. I told y'all that I wanted you to try to do this one on your own. So here's what I'm going to do. I'm not going to solve all of these for you, because again, I do want you to be able to figure them out on your own. If you have not been able to, or you got stuck on a couple and you are not sure what they would mean, I'm going to split the words. So it's adenoid, intercostal, you've seen before. Okay, hydrolysis, anesthesia, cystogram. Okay, so this is going to be a shared O, craniotomy, glycosuria. This is probably one of my favorite things to talk about because in the early stages of us understanding diabetes, I'm going to take a quick second. Okay, glyco means sugar, ura means urine. So if somebody has diabetes, if their body cannot process the sugars, what happens is you will pee some of it out. So their pee will smell like urine and Fruity Pebbles. One way that you can kind of figure out if somebody's diabetic, after they eat something that is like very sugary, and it's not directly after because obviously their breath will still kind of smell like it, but give it about probably about half hour later, check to see if their breath smells like Fruity Pebbles or their urine. One way they used to test this way back in the day to figure out whether somebody was diabetic or not, they would have them drink a sugary drink, and then after that, they would have to pee into a cup about 30 minutes later or like an hour later and then like 2 hours later. And then they would actually, and this of course is like way back in the day, we're talking 1800s, they would actually taste the pee of the patient. You can technically do that. Urine is technically sterile. We have talked about urine being sterile. We have talked about how you're not allowed to drink your urine just because you feel like it. It is one of those things where Mrs. Coach Branch is not giving you full advice to go ahead and taste your urine. Please, if you're at home, if you're going to do this after school, don't be like, hey, guess what Mrs. Coach Branch told me to try. I am in no way encouraging you to try your urine. It is a, not something I'm saying you could recommend, but I'm saying technically it is sterile. So they would taste it. They wouldn't like drink it like a soft drink. They would just kind of dip something in, taste it. And if it tasted sugary, then they knew their patient possibly had that. All right. Epidemio Ologist. That's another 2-1. Osteopathy. This one's also going to be a shared. Osteomy, cardiopulmonary, arthroplasty, cyanosis, dermatoma, myalgia, shared A, tachycardia, arteriosclerosis, I think this is a shared E, baby, mammectomy, sublingual, so I don't know if you can see it, that line actually goes on top of that L. I'm sorry, I shouldn't have done that. Erythrocyte, rhino, shared O, rhea, thrombocytopenia, proctoscope, gingivitis, and microcephaly. So if you didn't know how to split those up, that is how you split them up. So if you're still working on this last page, that is what I would like for you to work on. Now, if you are done and you have submitted your medical terminology worksheet, if you have your medical terminology worksheets to turn in today, you can give those to, if you're in my 7th grade class, Coach Jones will collect them at the end of the period. I will get them looked over and graded when I get back to school. I should be returning to school around 12:30. Alrighty? So if you are done with this, this is due at the end of class today, so make sure you get this turned in now that we have covered over medical terminology identification, matching health, and this back half section. I hope that you have completed it all. It is a massive grade. Okay, so now we're going to talk about what do you do next. So you guys do have a quiz coming up, and this video is going to replace this video here. I guess I should probably keep it all together, or I guess I'll make a separate page for medical terminology day 1 and 2 directions in case you are really behind. I really don't want you guys getting zeros on this, so if you guys are virtual, please get these taken care of, get it turned in. Okay, so if I click on medical terminology module, we've done all of this stuff. So now what you have are Quizlets to go through. So you've got this Quizlet to review, but I also believe I gave this to you the last time. So you can start here. You can change it to however you'd like to learn it. So you can do flashcards. Let me click next. You have the same thing with suffixes and prefixes. And again, with the quiz, you do not have to have these memorized, but the more that you can have memorized, the faster you can take your quiz. Next up, I have 2 GimKit games. So when you are done, you're just going to click here. and it'll automatically join you. So I'll put branch join. All right. So you have to earn $100,000 to complete this assignment. Click got it. And then you will see you have these different questions. So mal would mean bad. Boom. Dollar. Continue. Okay. So you are going to go ahead and play these GIMP kits until you get up to $100,000. You have a second game like that right here. And it'll take you right to the game. You put your name in again. Oops, not ranch. Branch. There we go. And it's going to be kind of the same thing. So we have Ophir, which means ovaries. Boom. Dollar. Continue. So you will continue to play tongue. Continue. These games as you go along until you get to $100,000. Now, if you only make it through one game, fine. If you can make it through both games, great. But that is what you guys are going to do today. Make sure you turn in your packet. I am going to be grading those. I would like for you all to have great grades. If you guys were in any other class, I would not collect them. When you turn them in, please make sure you keep that top page. You will need that top page for when you guys take your quiz. Alrighty? So I will see you guys on Wednesday. We will have a quiz Wednesday. I'll send out a parent email so that your parents know. And so be good for Coach Jones. I will see you all when I get back on Wednesday. And hopefully this review will help y'all with the quiz.